Alright, so this will be my audience for today. Okay, so today I will be doing my persuasive speech over telehealth and the modern nursing and ethical value it brings to patient care. Now, imagine you are an elderly patient living in a rural area with no easy access to healthcare. You're sick, but there are no nearby clinics for traveling, and traveling isn't an option. Being able to speak with a nurse and a doctor from the comfort of your home could mean the difference between timely treatment and medical crisis. That's exactly what telehealth provides. That is why I am here today, to persuade you on telehealth. It is a valuable and ethically appropriate approach to patient care in modern nursing. And my knowledge of this topic comes from my nursing education and research on how technology, including telehealth, is reshaping patient care while remaining consistent with the values of nursing professions. Now, to take my argument, I will cover how telehealth impacts our access to care, quality of treatment, and adherence to ethical nursing principles. Now, let's begin with how telehealth improves access to care. According to the American Telemedicine Association, in 2020, telehealth services surged by over 1,500% during the COVID-19 pandemic, especially benefiting rural elderly and under-reserved populations who often face significant healthcare access barriers. Take, for example, a single parent living in a low-income neighborhood who works 2 jobs without paid time off. They can't afford to spend the hours in a waiting room or travel across town for a basic follow-up appointment. Telehealth allows them to speak with a nurse practitioner from their phone or laptop at home, providing virtual continuity and care. Now, people benefiting from telehealth aren't just doing so in terms of convenience. The quality of the care is also being improved. Now, the quality of treatment. The telehealth advantage is a term used in the healthcare studies describing how virtual visits often result in better patient follow-up, fewer hospitals readmissions, and higher satisfactions rates, according to 2021 study in the Journal of Nursing Regulation. Nurses reported that telehealth helped them improve medication adherence and chronic disease monitoring. The U.S. Department of Health and Human Services in 2023 outlines how telehealth system uses HIPAA, a complement platform that protects patient data and allows for a secure evidence-based remote care. For instance, a diabetic patient can upload a glucose data levels or chart for a real-time feedback from a nurse care team, avoiding complications and unnecessary ER visits. Now, let's move on beyond these practical benefits to understand how telehealth supports nursing ethics. Now, ethical nursing principles. The American Nursing Association of 2015 Code of Ethics emphasizes compassion, advocacy, and access to care. Now, telehealth fulfills these by reaching patients who would otherwise fall through cracks, such as an elderly, disabled, or those living in poverty. Now, in my own clinical experience in my life, I observed an elderly woman who had a stroke and is a stroke survivor use virtual appointments to receive physical therapy from other physical therapists and doctors. Now, medication management she otherwise would have gone without due to transportation barriers. Now, Dr. Carolyn Routledge, a professor and telehealth researcher at Old Dominion University, explains that telehealth enhances the nurse-patient relationship by meeting patients where they are emotionally and physically comfortable. She says in one of her quotes, this, or telehealth, doesn't remove the human element, it allows to reach further. This shows that nurses can still deliver holistic, relationship-based care using modern tools by preserving ethical values while using innovative methods. Telehealth proves it belongs at the core of today's nursing care. Now, in conclusion, it is my hope that based on the evidence I provided you regarding access to care, quality of treatment, and ethical nursing principles, that I have persuaded you that telehealth is a valuable and ethically appropriate approach to patient care in modern nursing. And that you now see is, as it is not just a substitute, but as a smart, compassionate evolution in the way nurses deliver care. And that is my persuasive speech. Thank you for your time.